Welcome to TAAP Connect, the Digital Transformation Podcast. Today's episode, we have Louise Lawson and Paul Sheridan, two experts in the field of digital transformation. Together, they will be exploring the challenges and opportunities that healthcare organisations face with technology. So join us as we dive into this topic and learn how to unlock the potential of digital transformation to improve patient care.
Hi, Paul.
Hi, Luke.
So today's podcast, we're going to be talking about the healthcare sector. We're 4 weeks into 2023. And I just wondered if you can give me an update on any current challenges you're finding in the healthcare sector with either prospects that you're talking to or our current clients.
Yeah, the NHS is full of challenges now. It's in the news constantly at the moment, so everyone's aware of that. But what we are seeing, and which I'm very encouraged about, is the focus on innovation and technology to help with some of the operational challenges. Things around outpatients, patient pathway, patient discharge into social care, and how new forms of communication are helping the patient and the level of service. And what I mean by that is adding video to how a clinician deals with their patients. So there's some really exciting opportunities and innovation. Everything's governed by price and compliance and governance. But it's interesting how companies like TAAP, for example, a UK IP, are now being viewed because, especially since post-Brexit, some of the big prime providers to the NHS are being asked, have you got UK innovation as part of your portfolio into the healthcare? And that's what's helping drive what we're doing, helping reduce patient waiting lists and improve service. So very exciting.
One of the things I've been recently reading about is talent acquisition as well. So using a low-code, no-code platform to assist the healthcare sector in creating apps and solutions is an added benefit.
Absolutely. I mean, the sort of software development lifecycle model has almost been turned on its head. So the 20th century model was you would go out and buy a COTS product, and then you would find software developers who would understand and know that product, who would then develop and make changes, etc. Huge technology burden, what we call technology debt, so and what we're finding is more and more of those people move on. The technology overhang for these organisations is just another cost and another encumbrance for them. So what we're finding is that, with the lack of resources, the IT organisations that are overworked and have huge backlogs in terms of their delivery, operationally, the business is looking at alternates, and we are seeing, certainly in the trust that we're dealing with, a view of innovation and UK IP tech that can help solve some of those operational challenges. And a good example is working with outpatients, being able to digitally sign in and sign out now, being able to communicate through the clinician to the outpatient using video technology, but where this video technology also then captures all the data, all the actions, any notes that are taken, and is captured as a file as part of the patient record, which, because from a TAAP perspective, we have the key API integrations as part of our platform, that's HL7 and FHIR, FHIR, means that we can take front-end interaction with patients and clinicians, capture that data and move it back to the spine as part of a patient record update, integrating with spine products such as Cerner and Epic. They're the major ones. So that is real innovation, helping drive better patient service, but lowering the cost for the NHS Trust to deliver that service.
So we talked about digitalisation of processes. So that's moving away from essentially, you're meaning paper records and the transportation of paper from one department to the other. How's that affecting security of patient information as well?
It's a really good question because, even though we talk about the spine, Epic and Cerner, we then come across what the NHS call mini spines. So these will be local databases created to support a particular operation, and then within that there'll be workarounds with ward clerks or nurses updating Excel spreadsheets or Word documents or Access databases. And for the senior management and the operation of a hospital, not seeing all the data in real time is causing real problems. A good example is patient discharge. We've worked with a number of trusts where you have huge back office teams managing, updating Excel records to provide a management report by the end of the morning or by the end of the day. But of course, we all know that information's out of date the moment it's captured. So being able to digitize and connect all these different silos of information and connect based on how the nurses and the clinicians really work. And that's the interesting thing that I found, especially with the way that we work with our no-code platform, because they are the stakeholders. They're the subject matter experts of understanding how it is to deliver the service either at the bedside, within a clinic, and for them to be able to very quickly create the requirements to create the app and be involved in that process is quite empowering for them. And that then starts to filter up, because you'll then join in the sort of the Excel spreadsheets that they've created as a workaround now into a proper app that is now connected to the mini spine, which is now connected to the main spine, and suddenly the senior hierarchy can see real-time data, which improves everything across an organisation, from how the transportation hub works, how the porters are deployed, even through to how the hospital's cleaned and the cleaning teams. Suddenly you can geolocate, you can put SLAs and KPIs into these apps that then can be reported on. And so you're starting to see this whole digitisation, this digital transformation of how operations works. And that's really important for the health trust, because there are a couple of measurements that determine their funding. One is HIMSS, which is an acronym, but it's a standard. At the top level is being HIMSS 7, and that's an aspiration for most trusts. So one of the measurements of that is how do you capture electronic data and how do you manage it. And so using no-code as a way of creating apps where you are now managing and being able to measure your data helps with their HIMSS stage and performance. And that's pretty key to how they then get the next round of funding.
So if we look at the health sector as a whole and using low-code, no-code solutions and applications, what do you think are the three biggest areas where digital transformation can assist?
Well, in the areas that I'm involved in, we're seeing how digital transformation and innovation is really impacting how outpatients interface with a hospital. So it used to be the case that the outpatient and the clinician would tell the outpatient what time to turn up at the clinic and where. What we're now seeing is that with the integrated care boards and the integrated care systems, an ability across these trusts to share premises and resources. And the knock-on effect of that has been to reduce the amount of travel maybe an outpatient needs to do. So if it makes sense for someone in North London to visit a North London local hospital rather than come all the way into central London, or if you're out in the countryside or whatever, being able to use a local practice partner to hold that clinic. All that suddenly makes life a lot easier for the outpatient. And with technology connecting through video and audio, updating patient records with a GDPR wrap, etc., to the spine, is having quite an impact about how people now reimagine outpatient services. And of course, that's now being moved forward to organisations like A&E and emergency triage, for example. So suddenly you can have real-time triage based on an application that helps the nurse see in real time who's available, who's not available, and so on. And that's all about cutting waiting times or how soon a patient in A&E can be seen. We all see the horror stories in the news of people on trolleys and the impact that's having on ambulances dropping off. So again, we've worked with trusts about how to better use vehicles by digitising simple vehicle checks, for example, because every public service vehicle has to be checked before it goes out on the road. Having a simple app that can do that within seconds as opposed to a paper-based process, and that app is then updating the fleet management system, just provides a level of digital compliance, which saves the ambulance and paramedics huge amounts of time, and for the taxpayer, we get better use of that service.
So it would seem that the patient care can be improved, which is absolutely brilliant, the pressure on staffing, but also having an effect on the funding and taxpayers' money going back into the sector as well.
Yeah, absolutely, because they call them gold GDEs, digital exemplar hospitals, and it is about sharing, what works. So what we're now seeing is, trusts being able to share their innovation across other trusts. So why keep reinventing the wheel? If something is working at one trust and is seen to be successful, that should be available to all other trusts. And what we find, especially within TAAP's experience, is that the health trusts are very precious around their own IP. It was said to me recently that a lot of huge organisations have benefited by digitising NHS processes, and the NHS doesn't get any reward for that. Well, now here's a simple way that NHS trusts can capture their own IP and, from a commercial standpoint, either make that available free of charge to other trusts or license it in a way that is giving back to the NHS. There's this phrase in the NHS, keeping the pound within the NHS. And this is a great way of evoking that idea that, we're asking you as a company to come in and help, but actually what you're creating is ours. And, that also allows for simple things like R&D tax credits from HMRC, which a lot of trusts just do not use. So there's a lot of things that we're helping, not just on technology, but also on the commercial side of innovation.
So where would you see innovation going in the health sector? We've brought it to a certain point. Where do you see it potentially going? Or is that a question we just can't answer until...
Well, no, I mean, the great thing about our jobs is that we meet people who are subject matter experts in the job that they do. And I think what TAAP allows is for that ideation, those ideas to come to life. This phrase, fail fast. Try something. If it doesn't work, great. You haven't spent a lot of money. It's low risk. But in a lot of cases, the nurses and the clinicians and the ward clerks and the administrators know where the problem is. And they've been used to doing workarounds. And now what IT are doing with governance and control is giving them a platform that allows them to create something that works, that can, with the API integrations that I talked about, HL7 and FHIR, integrate to the back end. It's now lifting that data out of silos and making it visible to the people that need to make decisions. We have huge capability with our AI engine, for example, being able to create predictive analytics based on workflow rules, logic, business triggers, dashboarding, and so on. And it's that sort of innovation that is driving change, because you can't manage something if you can't measure it, and we're allowing that to happen. And what I find really interesting is, in other locations in the US, for example, where their health care system very different to ours, but the amount of innovation that they're doing in products like TAAP now to drive everything from vaccine management. So we're all aware of vaccine management with COVID, but we're digitizing that now for standard flu vaccinations, or working with pediatrics and children, and making sure that vaccinations aren't something that are horrific, but and so on, all the way through to video consultations, simple things like vehicle checks. The amount of vehicles that are involved in the health service, just automating and digitising how they capture that data, send it back to their fleet system, just gives them a better use of that resource. One fleet manager said to me, out of their 50 ambulances, they're getting more miles out of those units. Simple things like ambulance having to come off the road because they didn't realise the tyre tread was as low as it was, and they're having to then book commercial vehicle rates to do those rounds. Simple things like that allows them to schedule better is helping at an operational level. And yeah, we're now starting to see those clinical processes driven by HIMSS aspirations and electronic record data management improve how organisations across different departments or across different trusts are working.
And I think it's really exciting to hear about how digital transformation, not only from a patient perspective, but from a transport perspective and everything in between, is really helping the health sector. So it's been really insightful. Thank you for your time, and I really appreciate it. And I look forward to speaking to you again.
Yeah, no, it's great to help the NHS. It really is. Thanks.
I agree.